Well, good morning, everybody. It's really a pleasure to be here, and I want to thank Sally for that introduction and for her leadership in NACo, and she truly was right on point in terms of our association and the work that we need to do together. I don't need to tell you about the problem of opioid abuse in the United States. Every community and every sector of our society has been touched in one way or another by this epidemic. But let me just underscore just how serious this problem is. More Americans now die every year from a drug overdose than they do from motor vehicle crashes. More than 47,000 people in 2014 alone. With opioids, heroin, and prescription drugs, involved in more than 28,000 of those deaths. That's 129 people every day dying of a drug overdose. I'm going to show you two maps that illustrate just how much this problem has grown. The first is for counties with at least 20 drug poisoning deaths involving any opioid, both prescription drugs and heroin, from 2000 to 2004. And I want you to take a look. So yellow is fewer than 5 deaths per 100,000 people. Green is between 5 and 10 deaths. Light blue is between 10 and 15 deaths. And dark blue is greater than 15 deaths. So we saw some hotspots, but overall, most counties in the country did not show up because they had fewer than 20 opioid-involved deaths. So now take a look at this next map, which shows the same county drug poisoning deaths from any opioid, but this time it's from 2010 to 2014. Again, the darker color, the higher rates of deaths. And we all see what a big difference in the spread of this problem across this country. As these show, the rise in the number of opioid deaths is a trend that started more than 15 years ago. They have also shown that overdose death rates involving opioids have increased dramatically over time. Opioid use has exploded, and it's been driven by the prescription pain medications in the United States. For many, getting these pills was easy. In 2012, an analysis by the CDC showed that we are now prescribing enough pain medication in the United States to give every American adult their own prescription. And more than 60% of those misusing prescription opioid medications get them free from family and friends. So if a doctor prescribed these pills, they must be safe, right? Well, we know that's not the case. So there are two questions that I hear all the time. First, what's the federal government's response to this problem? And second, how can I help make our communities safer and healthier? First, let me talk about the federal response. President Obama has made clear that addressing the opioid epidemic is a top priority for his administration. And that's reflected throughout his tenure as president. In 2010, the Office of National Drug Control Policy released the administration's National Drug Control Strategy, which used a blueprint based on decades of scientific research and input from public health and public safety professionals across this country. Research shows that substance use disorders is a disease of the brain, one that can be prevented, treated, and from which people can recover. It's important that we invest in efforts to prevent and treat substance use disorders. Programs like drug-free community grants are key to building local coalitions to help prevent substance use disorders from occurring in the first place. And I know many of you have found your local drug-free community organizations to be important partners in the community. Reducing the availability of prescription pain medications is also an important part of our plan. The administration's 2011 Prescription Drug Abuse Prevention Plan has 4 main pillars: education, prescription drug monitoring programs, proper medication disposal, and enforcement, in a broad effort to reduce the number of unintentional overdose deaths involving opioid. Last October, I traveled with President Obama to West Virginia to talk about what we need to do to end the opioid epidemic and prevent young people from going down that path. While we were there, he announced a new presidential memorandum to require federal prescribers to get the training they need to expand access to treatment for prescription drug misuse and heroin use. Earlier this month, he moved the ball forward by releasing his fiscal 2017 budget, which emphasizes the need to expand access to treatment so people can get the help they need it when they need it. The President's budget calls for $1 billion in new mandatory funding over 2 years to expand access to treatment for prescription drug use and heroin use to help people seek treatment, complete treatment, and sustain long-term recovery. This budget is more than just about new funding, though. It represents our country's largest investment in treatment and prevention for substance use disorders in history. This is the first time in the history of our office that demand reduction and supply reduction efforts are funded at similar levels. This 21st century approach reflects the reality of the opioid crisis and how important it is to expand access to treatment and recovery support services so each of you can improve the health of your counties. So I want to talk about the importance of partnership. And central to the federal government's work to reduce overdose deaths is partnerships. Whether it's at the federal, state, local, or tribal level, working together makes us all the more effective and gets buy-in from stakeholders throughout the country. As county leaders, you all know the importance of building coalition and partnerships to tackle big and small problems. And I want you to know that we're here to help. At ONDCP, we run 2 grant programs that many of you are familiar with: our high-intensity drug trafficking areas, or HIDA programs, and the drug-free communities programs that I mentioned earlier. HIDA brings together law enforcement officials at every level, federal, state, county, and local, to coordinate on drug trafficking in their communities. This coordination and intelligence sharing makes everyone more effective in stopping drug trafficking. The Drug-Free Communities Program awards grants to local groups that build coalitions to prevent substance use disorders from occurring in the first place. I know many of you have seen the importance of your local HIDA and DFC groups firsthand. And for those who have not, I encourage you to see how you can be part of these programs to help support local efforts. So what else can you do as county officials? How can each of you make a difference? First, and importantly, you can look at how we can increase access to treatment. County government, leaders, public health departments, behavioral health authorities, hospitals, clinics, and healthcare centers should look at ways that we can increase access to evidence-based treatment, link overdose patients to treatment, and expand access to much-needed life-saving medications in our local jurisdictions. Screening, brief intervention, and referral to treatment should also be expanded in every healthcare system to identify people at the earliest stages of their disease. We know that people on medications for treatment of substance use disorders do far better than people who are not, and they don't overdose and die, and a proven method for recovery. So we should expand not just for people in our communities, but also for people who are incarcerated, so they can recover and not return to our criminal justice system, or worse yet, overdose after their release. My office has heard from individuals who are incarcerated and in treatment. These individuals have told us that medication-assisted treatment combined with counseling has played a major part in their recovery. One man even said that without medication-assisted treatment, the warden may just hold the prison door for him because without his treatment, he'd certainly be back. By allowing people in the criminal justice system to access evidence-based treatment, you can support successful reentry and recovery, reduce recidivism, and save taxpayer dollars, and importantly, continue to improve public safety. Second, you can increase access to drug disposal. As I said earlier, most people who begin misusing pain medication get them free from friends or family, making drug disposal an important part of our efforts to reduce prescription drug misuse. While the DEA runs periodic take-back days, counties can create and expand drug collection and disposal programs in their communities so we can get these medications with the potential for misuse out of our medicine cabinets. Just last week, I announced an initiative with Walgreens to put drug disposal kiosks in over 500 of their stores nationwide, and I would encourage you to explore those local partnerships. Next, you can reduce drug overdoses largely through the use of naloxone. As county government leaders, you can promote naloxone distribution through local law enforcement and other first responder efforts. I can't stress enough just how important naloxone is, and I know many of you have seen the miraculous life-saving properties that naloxone can play in your communities. It literally saves lives and helps people enter treatment for substance use disorders. You can also provide syringe services programs so that people have access to clean syringes. Research shows that syringe service programs can help reduce outbreaks of HIV and viral hepatitis by confronting the source of the outbreaks, injection drug use, often related to opioids. I think we all saw what happened in Scott County, Indiana last year on just how fast these diseases can spread when people share needles. We were very fortunate that there was a bipartisan budget agreement that President Obama signed into law in November that revised a long-standing ban and allows high-risk communities to now use federal funds and services associated with syringe services programs. And finally, you can promote evidence-based prevention in your local communities. Preventing substance use before it begins is the most effective means of reducing substance use. However, we need evidence-based efforts. Local and state governments are the best suited to convene local stakeholders and community leaders to support proven strategies for evidence-based prevention. And there are several resources that exist. Use these resources to promote prevention, and I encourage you to make use of all of them. So in closing, we have the ability to save lives, both at the time of overdose and through treatment and recovery services. Our counties are critically important to reducing the demand for drugs, particularly opioids, helping people access treatment, and reducing overdose deaths. You are on the ground in the communities, and you see the things we're hearing and talking about firsthand. There's so much you can do to make a positive difference in your communities, and you can count on me as a partner. Thank you very much for your partnership, and have a great conference. Thank you, everybody.